Fine.
Uh, Dr. Dr. Meghna Sai, you have joined? Dr. Meghna Sai, have you joined the meeting?
Dr. Meghna is not here just yet, but I'm here if you don't mind making me co-host. Kyle Wolfson. I'll be sharing Dr. Sankaran's video.
You will be sharing, na?
Yes, if you can make me co-host.
Let me. Dr. Pankaj, can you make KYLE Ufstolen?
Perfect.
Make him the co-host now. I think you are. Dr. Pankaj?
Yeah, sir, you can share. You can share. I'm allowed.
Okay, perfect. Thank you.
But please wait, sir.
Yes,
Someone
yes.
will introduce you.
Yeah. You tell me when to start. Thank you.
I thought Meghna Shah will be joining, na? She's also joining?
I think she will be joining. She
Okay.
might be 10 minutes.
Let us wait for some time. We have Dr. Simmi.
Yes, sir.
You are joining. So now the time is up. You can start the meeting now, sir.
Oh. Good evening, everyone. On behalf of the Homeopathic Medical Association of India, I extend a warm welcome to all our distinguished guests, colleagues, and participants joining us this evening for our monthly scientific webinar. I am Simmi Singh, your moderator for tonight, currently a second year BHMS student at Nehru Homeopathic Medical College, New Delhi. These monthly webinars reflect HMEI's commitment to academic excellence, scientific dialogue, and continuous learning within the homeopathic community. We are grateful to all the participants from across India and abroad for being part of this initiative. Let us now begin today's session. We are honored to have some of most distinguished names in Indian homeopathy with us this evening. Dr. Shamar Mukherjee, National President HMAI, Dr. A.K. Gupta, Dr. Sanjeev Kumar Singh, and Professor Dr. Subhash Singh, Director at NIH Kolkata and Chairman of Scientific Seminar Committee HMAI. We are also honored by the presence of Dr. M.K. Sahani sir, whose vision has tireless education, tireless dedication have been the backbone of this webinar series. So, your presence this evening makes this session truly special. We extend a warm welcome to each one of you present here. I now have the privilege of introducing our speaker for this evening, Dr. Rajan Sankaran, practitioner, research scientist, teacher, and author, one of the most significant contributors to homeopathic thought and practice in the world today. But before we speak of the man himself, we must speak of where it all began. There is something fascinating about the history of homeopathy. Several of its stalwarts did not begin their journey here. They trained in conventional medicine, began their practice, and then encountered something they could not solve, an illness, their own or someone else close to them. That conventional treatment could not touch, and it was homeopathy that did. Dr. P. Sankaran, Dr. Rajan Sankaran's father, was one such clinician. He trained in allopathy and Indian medicine, began his practice in Bombay, fell seriously ill within a few years of starting out, and found no relief from the best conventional treatment available at that time. Homeopathy cured him. That experience changed everything. He converted, dedicated his life to this science, and became one of India's most respected homeopathic teachers and authors. This is the foundation on which Dr. Rajan Sankaran was raised, not just as homeopath's son, but as someone for whom homeopathy was never theoretical. It was lived. He graduated as a gold medalist from the Bombay Homeopathic Medical College and went on to build something entirely his own, not just continuing his father's legacy, but expanding it in directions no one had quite gone before. His intellectual contributions are well documented. The concept of disease as a delusion, newer miasms, classification of disease states into kingdoms, the seven levels of experience, and the landmark sensation method, a framework that has brought far greater depth and predictability to homeopathic prescribing worldwide. He heads the Other Song International Academy of Advanced Homeopathy in Mumbai. His outline program, Wednesdays with Rajan, was watched across over 43 countries. He has lectured across 5 continents and holds a fellowship of the Society of Homeopaths UK. His books, The Spirit of Homeopathy, The Substance of Homeopathy, The Sensation in Homeopathy, and Insight into Plants Structure, are translated into multiple languages and used as reference texts globally. But beyond the credentials, there's something in his work that stayed with me, something that personally caught my attention about Dr. Rajan Sankaran. And I say this as a student who has only recently started reading his work, is that there is someone who has given homeopathy some of its most intellectually demanding literature. The sensation method, the kingdoms, the levels. These are not light reads. And then this same person comes forward with a book called Dog, Yogi, and Banyan Tree. That title genuinely made me pause because it doesn't sound like it belongs to the same person who wrote Structure or Insight into Plants. And maybe that's exactly the point that for Dr. Rajan Sankaran, a dog on the street, a yogi he crossed paths with, a banyan tree standing somewhere, each of them had something to teach and he was paying attention to that. I think that quality of being genuinely curious about everything, not just homeopathy, is probably what makes him the kind of clinician and thinker he is. Before we begin, allow me to briefly set the context for this evening's discussion. Today's topic is the five finger method in homeopathic practice. The five finger method offers a structured yet flexible framework for case taking and remedy selection, integrating multiple dimensions of the patient's experience into a coherent clinical process. It is both a practical tool and a philosophical approach to understanding the human being in front of us. With that context in place, we will now watch a video presentation on this topic shared by Dr. Kyle. You can share the video, sir.
So welcome everybody, and it's nice to see all of you, and I am sure that you have come here to learn something. Am I right or wrong? Yeah. It's a very muted response. But nothing else is there to do, you see. And basically, we all want to do something good for our patients. So Hanuman begins his organon with that aphorism: the physician's high and only mission is to restore the sick to health, to cure as it is termed. So he makes it clear that the reason we are all here is to sharpen our skills and to learn things that can help us achieve this mission of helping our patients. Am I right or wrong? Yes, very good. And you see, patients, when they come to us, they come with suffering, they come with pain, they come with disability, they come with emotional and physical problems. And as a human, you feel a certain degree of connectedness, a certain degree of empathy, you can say. You can feel the pain of the other person. I'm sure all of us feel that. In some sense, the pain of the other person is also our pain. And it's from this empathy, this connectedness, that comes the desire to use whatever means we have to help. Now, as you know very well, there are two approaches broadly to treatment, to healing, to curing, to helping also. One approach one can call is a modern medical approach, and one approach you can call it as a holistic approach or homeopathic approach, you can say. And I do believe that it is not that one is right and the other is wrong, whichever you choose. That each approach has certain advantages, certain scope, and each approach has certain disadvantages or limitations. The modern medical approach, its aim is to kind of fix the problem. So there is a procedure of diagnosis, which means find out which part of your body is affected and how, what is the exact pathology, what is the parameters, what is your blood test, what is your diagnosis. And then if you can find a diagnosis, which is not always possible, you target your treatment to that specific part or that specific diagnosis. And so you have specialists. You have a specialist for every part of your body. And so the patient lands up with sometimes 6 or 7 specialists at the same time, each one looking after a different part of his body. Is it not? You have seen this? Patients must be bringing sometimes a whole file. Sometimes this file is so big that they have to use a separate car to bring the file and another car to bring them, and 2 people to carry it into your room. So this is me. And then one specialist, another specialist. It's like this, you can see that. Sometimes they say that, one guy says to the doctor, he goes to the ear specialist and he says, I have a problem in my inner ear. He says, sorry, I am a middle ear specialist. And he says, okay, actually my problem is in my left middle ear. He says, sorry, I am the right middle ear specialist. So that kind of specialization is based on the idea that we need to fix some part of your body that is not okay, and we need to diagnose it. We need to find out exactly through multiple investigations, etc. And this approach has advantages because it helps the problem. It relieves you of pain. It gives you good relief of your symptoms. Sometimes it halts the progress also of the disease. Right? And in some cases, you have chemotherapy in cancers and you have steroids in autoimmune and other disorders, you have bronchodilators, you have antihypertensives. Antihypertensive will bring down your pressure, bronchodilator will give you relief of asthma, right? Painkillers will relieve you of pain. But there are three problems here. The first problem is that these medicines are short acting because they have to be given almost continuously. And normally when you ask the specialist till when I have to take it, he will say till the rest of your life, most of the time. It's quite lucky that he doesn't say thoda goli leke bhi jao, on the way you may need it. Right? So that is the first issue. The second issue, of course, is that all medicines have side effects. If you read the pharmacy book of Goodman and Gilman, is the most authoritative book on pharmacy. The first line is, no drug is free from side effects. No drug. So this is what you have to be aware of. So new problems are produced. And it is well known fact, for example, in America, that the second or the third largest killer of people is drugs. It's called iatrogenic disease. Disease is produced by treatment. The second or the third largest killer. So that is the second problem. And the third problem is that many times you don't have a clear diagnosis because the problem is not only in one part, it's in many parts of the body. Which means, in short, that diseases are not local issues, but they are problems of the whole being. We are sick as a person. Then our organs or parts, they get disordered. The problem is in the whole being, in the center, not in the periphery. You see? So when the center is corrected, everything gets corrected. This is holistic treatment. So we come to the other side now, that along with the modern medicine, which is good, but has its limitations, we need to also explore homeopathy or holistic medicine, because everybody, even the most ardent modern medical doctor, when you go to him, he will say, कुछ टेंशन है आपको? हाँ है, टेंशन कम करो. Because they recognize that stress is a major factor in disease. तो you ask him, हम टेंशन कैसे कम करेंगे? गोली ले लो, उसके लिए भी गोली ले लो, or whatever. So they recognize that stress is a big factor, the way we think, the way we perceive, the way we feel. You see? And along with that, our whole economy, the mind, the nervous system, immune system, endocrine system, all work together, and the whole orchestra of our being is not playing the right music, is playing something else. We call it the other song. You see? So that has to be brought in tune. See our colleague who sang today, how beautifully she sang. It was so melodious because all the surs were coming beautifully. Yes or no? Beautiful. So when there is harmony, when everything plays together, then the whole healing happens. And in order to heal the person, we need to understand, perceive, not understand. Understand is intellectual. We need to perceive, to observe, to recognize this other song that is playing in the person. You see? And we need to match it to the exact homeopathic remedy. And when that happens, then real healing begins. And when real healing begins, the dependence on modern medical treatment should reduce. You should need less and less medication. You should be more able to heal yourself. And this is what we see in a number of cases. And I can tell you that every homeopath that you meet, or even I met, will always have cases of success. Yes or no? Usually they have it on their cell phone. So when you meet them anywhere, they'll open, look, this case I saw, see this, and now see this, see this, see this. They are very enthusiastic. Sometimes in the wrong places, Once I was sitting with a very well-known colleague in a restaurant, eating my khana with him, and then he opened his phone, look, doctor, look. Then he said, what is it? Then see this patient. I said, see his sonography. I said, yes, what is it? Then he put his hand in his pocket and took out one stone. He was carrying it with him to lunch. And what is this? He said, this is his gallstone. I said, how did you get it? So you think I gave him the medicine, he passed it from his stool. I collected it. I said, can you please, at least when I'm eating lunch, so I made a rule for him that whenever we have lunch, because he cannot stop talking about homeopathy, I said during lunch only ailments from this area upwards. You can do sinusitis, epilepsy, okay, no problem. But gallstones, piles, fissures, not when I'm eating. Sorry. So every homeopath has success. But the problem is, are these success consistent? Are they reproducible? This is a problem. You see? How can we make it reproducible? This is a question. And that's what we have all homeopaths been working on for the last 200 years or more. How to make our success more predictable, more reproducible, more consistent. So, let's see. So the subject of our seminar today is from keynote to superclass. What does it mean? It means from symptom to system. Keynote means symptom. Superclass is system. So this has been our progress, our evolution, that from a purely symptomatic approach, which we call symptom similarity. So from this, in order to increase our consistency, our predictability, our reproducibility, we found that if we look at the other side, which is called system, then our success rate increases significantly. It is not 100% yet, not at all, but definitely much better. So that's what we are going to talk about in this 2 days of seminar. So what is the symptom approach? Here you have the mental symptoms, physical symptoms, general symptoms, and by meaning of mental, physical and general, we always mean the characteristic symptoms, not the common symptoms. Means mental characteristics, physical characteristics, general characteristics, and keynotes. Keynotes are generally characteristics. The main characteristics of a remedy are called keynotes. In classical music, a raga, will have keynotes, vadi and samvadi, it's called, the main notes of that raga. Like that, the keynote of a remedy are the main characteristic around which the remedy revolves actually. These are the symptoms. This is what we have been practicing for last 200 years. And what we are introducing is something called a system. Now this system has 3 aspects or coordinates. What are they? We'll just look here. You see, these 3 coordinates or aspects. The first aspect is called the superclass. And what is superclass? It is the core dynamic response. What is the core, main, deepest dynamic response? Don't worry about it at the moment. By the end of the seminar, you will know it thoroughly. Okay? So the first aspect is the core dynamic response. It is called the superclass. The second aspect is the kingdom and the sub-kingdom. What is the kingdom and sub-kingdom represent? the type of response. The type of response. And the third aspect is called the miasm. And what does the miasm represent? The pace, the speed, the degree of hope or desperation. So these three aspects, the superclass, the kingdom, subkingdom, and the miasm, these are the three aspects or coordinates of the system. So therefore, if you put out your hand, we can identify 5 different aspects of a patient or a remedy that we need to look at in order that we are sure about what remedy we are giving. Do you follow like this? Yes, no? So this, can you put out your hand like this? Yes, very good. All of you have 5 fingers? Okay, very good. This is what we want. We want 5 fingers. So, you keep your hand like this and then tweak your thumb. This is the superclass. This is the kingdom, subkingdom. This is the miasm. This is the characteristics. And this is the keynotes. Keynotes or source qualities. These are the 5 things you have to match. See, I made homeopathy simple. Yes or no? Yes. When the patient comes, just show him this. Now, we will take it a little bit further, and you can see here that what I ask all my doctors to do is to make sure they write it on their finger so they don't forget it. Then they can look, okay, now. So, what I suggest you, take your pen. You have a pen in the kit. Get your next door neighbor and you write this 5 things on their fingers. You can do it right now. You write there on first finger. If you write, you will not forget. Superclass. Second is kingdom, subkingdom, we wrote K and SK. And then miasm, peculiarities, PQRS, and keynotes and source qualities. Now when you do that, you have a pen here. A pen. See, I am writing for Sarah, You can also do. Thumb. Superclass. Then, first one, kingdom and subkingdom, K and SK. Then, next is miasm. Next is peculiarities. And last is keynotes and source qualities. And in the middle, we will put, can show. See, we can put the remedy. Now, the thing is, if you have a pen, try this out. Take your pen and try to hold it with only your thumb. Do it, no? And take your other hand and try to pull it out. Easy or difficult? Easy. Now take your pen and try to hold it only with the little finger. try to grip hard and try to pull it out. Easy or difficult? Easy. So if you only rely on one thing, keynote, or on superclass or any other aspect, it will be easy to dislodge. But now try holding it with all of it and try to pull. You may not be able to do it. If you are able to do it, see a neurologist. So what is the meaning of this exercise? That when all these aspects come together, then you are having a grip on the case. If you prescribe on one aspect or two aspects, it may not be so firm. So, this is what we did, I hope. This grip, this is what we want. Now, how to get this grip? How to get a grip on the case, how to get a grip on the remedy. For that, we have to understand all of this, We have to understand what is superclass, what is kingdom, subkingdom, what is Mayism, what are characteristics, what is keynote. And we are to able to recognize these in the patient. So therefore, we will study each of this first, and then we will show you cases where you can identify them. So firstly, we are talking about superclass. So how to know what is a superclass? For this, I will ask you to take out paper and pen and write something, what I will tell you. Okay? What is it? You have to imagine that you are lying down in your house. Just imagine. You are lying in your bedroom and you are alone. Somewhere in the night, you hear some sounds, you are woken up by some sounds in the adjacent room or somewhere else in your apartment. You open your eyes, some sound is coming, as if somebody is there, as if, you don't know, maybe something fell, something happened, some noises which normally should not be there. So, you have to close your eyes now. Imagine this as if it's happening now. Looking at me will not help you, because I don't look like a robber also. So if you have to experience, the whole homeopathy is learnt by experience, not by listening or by thinking. So imagine, put your eyes closed, put yourself in that situation, and you are woken up from the sleep and there is some noise in the other room. And then start to become aware of what would be your first instinctive response. Become aware. Not your thinking, not your logic, instinctively, without thinking, not what you should do, no. But instinctively, what would be the response? And when you become aware of that, take your time, there's no hurry. But don't think, just first response that comes to you. What would you do? Instinctively, impulsively, immediately. And then write that down in 2-3 lines or sentences on your paper. Just write that. Write down what they say. Yes, so if somebody would like to share what they have written down, you can put your hand up and you share it. We will learn a lot from your sharing.
So obviously the sound is disturbing to me, and I may go and try and stop the source of the sound if I can. If not, I sit with the disturbance and try and ignore.
So if you don't mind, can you tell me what do you mean by the word disturbing, unrelated to this situation? Just the word disturb or disturbing, what does it mean?
It's opposite of something that I would like to be restful and be with myself.
What means restful? Just one, what does it mean, restful? Just what is the experience of being restful?
Quiet.
Quiet, yes.
And at peace and be with myself.
Very good, very good, wonderful. Thank you for sharing. Somebody else?
Okay, so what I would do is I would...
Who is speaking?
This is Dr. Prashant.
Yes.
So
Yes, go ahead.
Yeah, I would ask my wife and kid to be safely inside the room. Then I would grab a stick or some makeshift weapon. Then I would cautiously go towards the room from where the noise or disturbance is coming.
Yes, stay with it. What would be your experience in this situation when you are grabbing a stick and you are cautiously going into the room? How does it feel inside?
I'm highly alert, and the adrenaline is pumping, and I know that there is a threat somewhere, and so there is no thought except that a high degree of alertness is there, and to go and meet a situation.
Very good. Wonderful. Excellent. Thank you for sharing. Now, somebody else.
Sir, as you told, the first thing is we are sleeping. That means I'm sleeping. So the thing what I would like to do is,
Little slowly.
yeah, the thing is, first we will listen or observe what is happening actually. Without understanding what is the sound or what it is, we cannot come to a conclusion like how to proceed. So first thing what I would like to do is we like to observe it.
So what would you do?
Like kindly know that like.
Little closer, the mic little closer.
Like kindly know what is happening actually, what is that sound, like
Yes, so what would you do?
like as I'm sleeping, first I will understand it what it is, then I can decide what is my response.
Right. So in the process of understanding and observing and listening, stay with the mic. In that process, what is your experience? How does it feel inside when you are listening, observing, understanding, etc.?
It will be like fear, sir. I'll be a bit
What?
scared because I'm alone, I'll be a bit scared.
There is fear.
Fear.
Describe the experience of fear. If you don't mind, just stand up and so people can see you. How does fear feel?
I'll be a bit anxious, like what is going to happen next.
Right. So when there is fear, what is the instinctive response? You feel fear. How would you respond to that fear instinctively?
The thing is to protect myself.
What is protect? Just the word protect, unrelated to this situation. Just the word protect, hanging there in the air. What is protect?
To make sure if I'm safe.
So if I would ask you to give me an image that shows protect or safe, what image would come to you, or to illustrate or draw or something like that? I'm giving you a paper and pen and say draw the word protect and safe. What would you draw? Or let's ask in another way, just the meaning of the word protect. One child comes and says, what is protect? What will you say?
That's what, sir, to make sure that the person is safe from any
Right.
external influences.
No issue. Very good. Thank you so much. Okay. Somebody else? Yes. I need some female also. Too many men. We need to have, gender equality is very important.
When I am sleeping, when I am hearing the sound, I am scared. At that situation, I want some support who can handle my situation. I think that someone should come and support me.
Support you. So
Support.
can you stand up? Yes. Describe the word support.
Support means some member in the house should come and give me some guidance.
Yes.
What should I do in this situation?
Yes.
On hearing the sound, when I am being scared, there should be someone to
Suppose
push me.
you detach yourself from this situation and just describe the word support, and you showed something with your hand, correct? Support. What is support?
Support means someone to direct me in what situation, in that situation, how should I stay?
Right, right.
The person should means manage me, that what should I do at that situation?
What should you do?
What should I
Right.
do at that situation?
Right,
Should
right.
I go forward or should I stay in the same
Somebody
situation?
should tell you like this.
Yes.
Yes, very good. Wonderful.
Sir, it will be a fear for me.
Who is speaking? Who is speaking?
Dr.
Nobody
Shabnam.
knows.
Dr. Shabnam Inamdar.
Ah, where are you?
Here.
Ah, at the back.
Yeah.
I get frightened when I hear a voice and I can't see anybody. You know?
Same feeling I will have after watching Robbers. First
Okay,
it will
go
be,
ahead.
Yeah, first it will be fear, then alert mode. I will try to search, and then we'll worried about family members.
Yeah, yeah. What means alert mode? Just this word. What is the experience or the response to this alert mode?
Alert mode means as there is some sound and there is in back of my mind that whether it is a robber and if it is on how much distance.
Yes.
So that way it will be alert.
So what is the response to this feeling that it can be a robber, how much distance? What is your response? What would you do?
First I think I'll get so much frightened that heartbeats will increase.
Yes, what will you do?
I'll try to call police.
Try to call the police, okay. And before you call the police, what will you do?
Many times I did it like robberies around my house. So with the help of police, I have caught them on the spot many times. So my first option will be calling police.
Okay,
Yeah.
okay, no issue. Wonderful. Who else? 1, 2 more women and then we are done.
Hello.
Yeah.
So my first response would be go and check where the noise is coming from.
Okay.
If I confirm that it's a robber, then I would prepare myself with some tools or anything to defend myself. Or if I feel the other person is more powerful than me, then I would run.
You will?
Run.
Run. Okay. Yeah. Very good. Wonderful. Very good. Are you good at running?
Yes.
Good for you. Yes. Okay. Thank you.
Sir, first I'll wake up from the sleep. As you told, the situation is like we are sleeping. After that, I'll try to hear one more time, like from where the sound is coming. If it repeats again, I'll be scared, panic, and if the sound continues.
What will you do with this scared and panic? What will be your response?
If it continues, I may lock myself in the room. If it is from, from other room.
You will lock yourself in the room.
If it is from some other room, if it is from the same room, I'll go away from where I'm getting this sound or something.
Yeah, okay, very good, wonderful. Very good. One more, last. Yes. Wait with the mic.
सर मैं लड़ने की कोशिश करूंगी, फाइट करने की कोशिश करूंगी.
You will fight?
हाँ.
How?
Sir, वैसे भी I know the karate and I got a chance to fight with them.
What will you do? You will fight and?
First of all, I मतलब सिचुएशन को समझूंगी और थोड़ा सा उसके हिसाब से मैं कैसे डट कर सामना कर सकती हूँ. तो in any situation I will handle with that courage.
Can you describe the fight? What will you do to that poor chap?
सर अभी लड़ना तो पड़ेगा, तो डर के क्या फायदा है या भाग के क्या फायदा है. अभी डोर तो एक ही है, तो डरने के मतलब ही नहीं है. तो जो है तो उसका सामना ही करना सबसे बड़ी बात है. मतलब वो सबसे सही होगा.
Are you standing for elections?
Yes, sir. When I got a chance, I definitely stand for election.
Okay. We will vote for you. Good. Wonderful, wonderful. Good. So what did we learn from this little experiment? Can somebody say what we learnt? Just put your hand up because can't hear too many people. Just anybody. What did we learn? What? Yes. Yeah. Wait. Yes.
Different experiences for the same situation.
Yes, very good. Wonderful. So, given the same situation, the type of response is widely different, isn't it? And each one will have his type of response. This type of response is what we call as superclass. So let us try to understand what are the different superclasses, and after that I will ask you to share once again if you could identify your superclass. Okay? The first superclass, 6 superclass, each one has its basic reaction or basic response. The first superclass is, the picture is a bit like this. You can see there is a Joey. Joey is a baby kangaroo and it's in the pouch of the mother, and the response of this superclass is withdrawal and clinging. Withdraw means to go into a shell, to shut off, to hold on, don't face. So maybe some of you with this situation had the feeling, oh, I don't want to hear it. You go into your bed, into your covers, put the pillow over your head and just try to disappear. It's possible. You hold on, try to disappear. The second one is, let me open the door a little and see if there is anything dangerous. Because if there is, I'll shut it immediately. Let me try a little thoda with one eye only. This response is the second superclass. It's a opening and shutting. Open and close. Peep out, see if it is safe, and if it is too much, just close the window. Inside this safe space, some people talk today about safe space. Inside this safe space, it is safe but dull, grey, monotonous, boring. Outside, it is exciting, but full of color and sound and beauty and all of that, but risky. Oh, so it's like going in and out. You know, if you liken the first superclass to an oyster that remains inside, the second superclass is like a snail that peeps out, and when there's a problem, it goes in again. Then we see the third superclass. This third superclass has to do with limitations. So somebody said, you know, I will lock myself in the room. Means what? I will remain inside a certain boundary, a certain limitation. Inside this, I am okay, I am free, I am good. Outside, no, I don't want to cross that, it's too risky, too adventurous. So this is, you might have seen, the parents are saying to the child, go play, enjoy, but not outside this boundary. This is your limit. Or Lakshman told Sita, enjoy, have a good time, but inside this boundary. This is the Lakshman Rekha. Outside, no. So, everything is good inside the limit. Outside is open, but adventurous also. You follow like this? Hello? So, the next one is the fourth superclass, and that is stable and settled. I want that everything should be the same. In fact, it says, I don't want any disturbance. I want quiet. Somebody said, I don't want to be disturbed. This is the fourth superclass. Let the smoothness, the status quo continue. The opposite of that is disturbance. The fifth superclass is get out. Because here the feeling is that I need to get out. I cannot just be protected, or I cannot just lock my door. I cannot just not be disturbed. I need to do something. I need to come out. And when I come out, it's a lot of alertness. I have to be very alert. See, I can't rest. The opposite of rest is alertness, restlessness. And I must come out. So somebody said, I leave my wife and kid, but I will take a stick and I will go cautiously outside, and I will be highly alert. There is a threat somewhere. I cannot rest when there is a threat. I cannot lock the door. I cannot say I don't want to be disturbed. So, threat perception, restlessness must get out. This is the fifth superclass. Restless and must get out. And inside you feel stuck and suffocated also. Must come out, must be alert. And the last one, sixth superclass, is violence and destruction. And here you can see the fright, the fight, not only fright but also fight and flight mode. This is the karenge ya marenge story. Somebody said, I will fight. I have got a chance to fight with them. I will fight. No use being scared. I will fight. And the other one says, I will just run away. I will either fight or I will run. If the person is smaller to me, I will fight. If he is bigger, I will just run. Fight or flight. These are the 6 types of responses that are possible. And normally, all of us should fall into one type. At the core, what does mean at the core? Basically, instinctively, impulsively. You follow like this? So, at the core, this is how we feel. Are you able to identify your superclass a little bit? How many of you say yes? Okay. So I will ask again tomorrow when you understand it a little bit more. And all this, if you look in your kit, you will find this paper to make life simple for you. I have given you this reference, the superclass summary you can see here. First is withdrawal and clinging. Second is open and shut. The third is limit and expand. Fourth is stable and settled or security. Fifth is restless and get out. And fight and flight. Now, how does this superclass idea help us? So then you can see here in your paper that you can identify that if a person is in the first superclass, he will either need a mollusk, which is a bivalve like an oyster or a clam. Clam in homeopathy, Venus mercenaria. Or he will need from the periodic table the left side of the second row, that means lithium, beryllium and boron. Or he will need a remedy from the first subclass of the dicotyledons, which means remedies like pulsatilla, opium, nux moscata, helleborus, staphylos aureus, camphora, asarum. He will need one of this. So when you identify the superclass, you are able to narrow down your search to either this animal group, mineral group or plant group, which share the same kind of dynamic. What does the oyster do? Go inside. What does the lithium, beryllium, boron do? They represent the stage of development of being a fetus. So the person actually feels like a fetus. He wants to go inside the womb of the mother. That's what he will tell in his history. And what does opium do? Or helleborus do? Or camphora do? Nux moscata do? Staphylos aureus do? Pulsatilla do? They become anesthetic. They become numb. You see? So they don't feel what is going on outside. They go inside. Similarly, if a person's dynamic is the second superclass, then he will either need gastropod, which means a snail. Snail in homeopathy, one of them, Cypria eglantina, the cowrie snail, or the garden snail, Helix tosta, like that. Or he will need a remedy from the fishes, or he will need a remedy from the carbon, any carbon like graphite, petroleum, carbo vegetabilis, carbo animalis, adamas. Or he will need a remedy from the second subclass of the plants, which is called the Hema melody, especially remedies like cannabis indica, Fagus sylvatica, remedies like that. If he is a third superclass, he will either need a bird remedy, because birds, they are either limited or flying free, right? So remedies like Heliatus leucocapitis, which is the eagle, or Falco peregrinus, which is the peregrine falcon, remedies like that, or they will need the third row of periodic table, which is remedies like natrum, magnesium, alumina, silica, phosphorus, sulfur and chlorine, or he will need remedies from the third subclass, which is called the Caryophyllaceae, and remedies are like Cactus grandiflorus, Cereus boneplandy and Phytolecca. If he needs the dynamic of the fourth superclass, means he wants always security and stability, then he will need mammal remedies like lac caninum or lac defloratum. He will read remedies from the fourth row, which means remedies like kali, calcarea, ferrum, cuprum, zincum, germanium, gallium, arsenicum, selenium, remedies like that. Or he will need remedies from fourth subclass, which is called the Dilenidae, which is remedies like bryonia, cyclamen, like that. If he is in the fifth superclass, his dynamic, then he will need either insect remedies, spider remedies, or cephalopods, which means sepia and octopus. Or he will need remedies from the right side of the second row, remedies like nitrogen and oxygen or nitrates. Or he will need remedies from the fifth row of periodic table, remedies such as palladium, argentum, etc., antimonium, strontium. Or he will need remedies from fifth subclass, which is called the Rosidae, remedies like Rustox, Anacardium, Mangifera, Euphorbiae, Croton tiglium, like that. Or even Baptisia. If he dynamic is in the sixth superclass, then he will need remedies from the reptiles, Lachesis, Naja, like that. Or heavy metals, the sixth row metals like aurum, mercury, thallium, plumbum. Or he will need remedies of the sixth subclass, which is called the Asteridae, remedies like Belladonna stramonium, Naxomica ignatia, Arnica chamomilla, Cicuta conium, digitalis, like that. So, the identification of a particular dynamic response in the patient, when we ask him, what is your nature? What is your response? And then if you are able to identify which superclass he falls into, then your search for the remedy becomes limited to a certain group of minerals, plants or animals which share a similar dynamic. You follow like this? Hello? So some of this we have put it here. All those remedies and all that to make it easy for you. And below we have put typical remedy, and in typical remedy you can see there is a remedy from plants, animals and minerals. So this is like an atlas or like a map which you can use in your practice, and I tell you, it will make a huge difference to your accuracy. It is also a map by which we can understand remedies, by understanding into which core dynamic response they belong. For example, what is the difference between the fright of aconite, which is in the first superclass, and the fright of belladonna in the last superclass, sixth superclass? The fright of aconite will make him panic and go inside. The fright of belladonna will make him violent and go outside. See, belladonna will be fight or flight response. What will happen to the pupils? Dilate. That's what the eye doctors do, no? They put belladonna into your eyes, or no? Atropine. So it causes a sympathetic nervous response. Pupils dilate, heartbeat increases. You get ready for fighting. What does aconite and opium, what is the shock of opium? He becomes numb. He becomes anesthetic. He doesn't feel anything. There is no action. Are you with me or no? Yes. I will tell you a case. I was treating a lady in my clinic, and she used to be accompanied sometimes by her husband when they came. No? One day, I was sitting and she came inside. There was the husband. The husband said, "Doctor, I need urgent appointment with you. You must see me." I said, "Why? Why? What is the urgency?" So he said, "About 4 days ago, I was involved in a terrorist attack as one of the victims. Immediately my curiosity was, what happened? What's the story?" See, one of the advantages of being a homeopath is that you don't have to read the news, or they all walk into your clinic, the whole newspaper, and a lot of other things also. For example, you ask them, "Don't take photographs. I see some flashes, don't do that." We ask them what is craving and aversion, They say, I like that pani puri, I love it. And I said, "Yes, you like?" "Yes, but especially from that one Sharma Bhandar is there, in that Juhu area, that very good, tasty." So, of course, I write their case, but on the side I write, Sharma Bhandar, check it out. So sometimes homeopathic practice is amazing. I really feel pity for modern medical doctors, They get no knowledge from their practice about where to eat and what to do and what not. But they don't ask cravings and aversion, how they will know? So one patient, I'll tell you another funny story. One patient said, "Doctor, I have this clairvoyance. Means I can know what is going to happen." I said, "Tell me." He says, "Yes, in a stock market, I know exactly that this stock is going to go from here to there in so many days, and then it's going to go down. I know it. It flashes in my head. And it's always correct." I said, "Yes, that is good." He said, "For example, I got a dream the other day that Aspar Enterprises is going to go up next week and it is going to go up to 18th of June, and then it is going to crash. It's going to become 3 times. I know it. I wish I had money to put into that Aspar thing. I don't have, I'm not liquid anymore. I said, okay, thank you so much. So on the side, I wrote Aspar Enterprises and, sell it on June 16th. That also I wrote. As an experiment, I asked my broker, put 10,000 rupees in Aspar Enterprises. He said, what is Aspar Enterprises? What do they do? I said, I have no idea. But I have an expert opinion. The fellow put 10,000 rupees. It became 60,000 rupees on June 16th. I said, sell it. 18th it crashed. I said, wow. Next time the patient comes, I must pay a lot of attention to his dreams. But my problem is my memory. I don't remember who the hell that patient was. So I lost out. So in this way, I tell you, homeopathy practice has a lot of side benefits. What was I saying? Yeah, opium. Right. So this man, I was involved in it. I said, tell me about the terrorist attack. So sir, we were in Oberoi, in the hotel. And what happened was that we were eating in the cafeteria, coffee shop. The terrorists came, masked people like that, and pulled out the guns and everything, and made us go to the, God knows, 26th floor or something, etc., etc. And then they lined us all up, and in short, they shot us all. And out we were maybe 20-25 people. Everybody was killed, except 2. Me and one more person. And we were just lying there, and the bodies on top of each other, blood from... And I said, what to do? I said, I should not lose control. You see? I should just keep quiet. Just be like I am dead. That is the best way. And I whispered to the other guy who was alive also, just pretend to be dead. That's it. And of course it lasted for some time, and then the terrorists were eliminated or whatever. Then the security people came and they rescued us. They saw 2 of us were alive. And I got up, and there was, other people's blood, etc. on my thing. And they said, here is a t-shirt that you can wear. So I took out this, I put the t-shirt. And they said, now we'll go to the hospital for a checkup. I said, I'm fine. I don't need any checkup. No, we have to do the checkup, it is mandatory. So he said, I went out. I was not feeling a thing. The only thing that I was remembering is that I have to recharge my SIM card. So I told the police, listen, I don't have time for the checkup and all, I have to recharge my SIM card. And I quietly got out of there. I went and recharged my SIM card, and I took the transport or taxi home. And I just went in. I didn't say anything to anyone. I was okay. I mean, what to tell? I mean, what is there? And after 2-3 days, he told his wife I was in that terrorist attack. See? This is the first super class. It's almost as if nothing touches them. become numb. This is the response. This is the response, is to shut the world out. This is opium. So I said, I don't need to give you an appointment, you just take the opium and you will be fine. You see? If you want, I'll show you the rubrics maybe of this case later on. It's so beautiful. So in this way, this is not a belladonna response. Belladonna is not going to lie down and pretend to be dead and like that. He will make a break for it and start, it's either them or me. So in this way, if you understand remedies and which superclass they come from, you will understand a lot about their basic DNA, you can say like that. So this is the first, you can say, aspect of our system, the superclass. This is the latest one. Earlier there were two more, kingdoms and miasms. The superclass idea is so beautiful and so useful that we worked on it actually with my team here. Sarah is here, Kyle is here, Shiti is here, Meghna is here. We are, as a team, we work on this for the last nearly 2 years or so. And now it has flowered beautifully. And I will be teaching you this latest aspect of superclass. But I will be teaching you superclass in the light of keynotes. So we will understand keynotes and then we will understand the superclass and see the beautiful tango that they enact. So on this basis, I just completed writing this book called Superclasses in Homeopathy. It's not published yet, but very soon. So this is the first aspect of our system, and then of course we have the aspect of kingdom, which you can see on this side of the paper. Kingdom are 3: mineral, plant and animal. And there is a no-sword also. And the basic difference between the 3 kingdoms is very simple. When somebody says I, it means mineral kingdom. When somebody says something, it means plant kingdom. When somebody says somebody, it means animal kingdom. When somebody says it means no-sword. Okay? Don't take it at face value. Somebody comes to your clinic and says, I am having a headache. Oh, he said I. This is mineral kingdom. No. It's not like this. When the basic problem is with I lack something, I need something, I need support. Somebody said in this sharing, I need some support, I lack. Are you with me? Yes. Yeah. That is, when something affects me, I went to the terrorist thing and that had this effect, made me numb. Something affected me. He didn't say terrorists are bad people, we should eliminate them. No. He said something affected me. Or when he says somebody says, who is he? I am not afraid, I am going to finish him off. He is the problem. This is the animal kingdom. Do you follow like this? The same situation is how you view it. So the dynamic of response, superclass, the type of sensitivity is the kingdom. Then we'll go a little bit later after this. And the third one I want to show you is the miasm. The miasm is the degree of hope or despair in a given situation. So for this we have 10 types of miasm, and you can see here also I have put the miasm for you. Acute is, the response is panic. In typhoid the feeling is it's a crisis, I have to handle it quickly. In malaria the attack is intermittent. In SORA problem is solvable, solution is possible. In ringworm, maybe it's possible, maybe not, let's try. In psychosis, it is not possible, but I can live with it. In cancer, everything is out of control and I must control it. In tubercular, everything is very hectic. In leprosy, it's desperate. In syphilis, it is hopeless. So what is the degree of hope or despair? What is the speed or pace? This is the miasm. So there's also in your paper an 8-box chart, which means we take the patient's information according to 8 categories. And those categories you can see there: pathology, local complaints, general symptoms, mental symptoms, delusions, dreams and fears, sensation, kingdom and source, miasm and pace, or genius or pattern, or superclass. You can add there superclass. So the patient's information is collected from all these angles, and from these angles we come to 5 things. Shall we say together? Let's put our hand up. Okay. First the thumb, superclass, kingdom, subkingdom, miasm, characteristics, keynotes and source qualities. Okay? This is where we are going to get our information. So, we'll take a Dr.
Welcome you, sir. Welcome you, sir. Nice to see you.
Yes, thank you.
I'm Dr. Sani speaking, sir.
Hello.
So, Simi, you can continue.
Yes,
sir. Yeah. So thank you, Dr. Sani, for inviting me. And it is nice to see so many colleagues, I guess, from all over the country. And I will just continue from where the video stopped. Basically, I found that this 5-finger idea, which means to match 5 aspects of the patient with 5 aspects of the remedy, is giving me the most consistent results in practice. What it means is simply this, that we are not relying on one aspect or 2 aspects, but all the aspects. It's like, when you take fingerprints, it's like you're taking all the fingerprints and matching them. So I would like to, Kyle, if you don't mind, can we start with the first case?
Yes, sir. Please, sir.
So I will just illustrate this with, or maybe I can share my screen. That may be also. Let me do that. I think that's okay. So we are talking about a case of prostate cancer with multiple metastasis in a 70-year-old male patient with no smile. We'll understand what this means in a little while. He saw me 25 years ago in August 2001. And when I asked him, tell me what is the problem? Now, it's very interesting that he had come to me with like retention of urine. His bladder was hugely distended and he couldn't pass urine. So he came to me almost in a very acute situation. And they found it very difficult to operate on him or do anything with him because of multiple metastases. So when such a patient came and I asked him, what is your problem? The first thing he should have said is, I can't pass urine. My bladder is huge. But he didn't say that. He said, my problem is constipation. I was very surprised to hear that. And I said, tell me about the constipation because we have to go where the patient goes. And he said, the problem is that my rectum is very delicate. The skin is soft. The stool is very hard. And when a hard stool passes in my delicate rectum, because it's very delicate, I feel as if a cloth is being torn, as if it will tear the part. That was his complaint. And he showed it with his hand. He said, it's like this. If it passes like this, it will split it into two parts. So I said, okay, tell me something about your nature. And he said, I'm a very quiet person. I don't talk much. In fact, I don't even laugh. It is 30 years since I even laughed. I said, why don't you laugh? What is the problem? So he's saying, I am very concerned that if I laugh, then somebody may take it wrongly. Somebody in my family may take it wrongly. And then there can be discord, there can be some fight in the family. And because of this fight, the family will split apart. And for this reason, to avoid this splitting apart, I do not laugh at all. I do not smile even. What was surprising is that this sensation of splitting apart, he expressed in both the places, in his rectum also and with his family also. And it seems as if he felt that while the rectum is also very delicate, his family is also very delicate, that any slight misunderstanding can split the family apart, and he didn't want that.
I feel pain while passing.
Yes, sir.
Because on the tip,
Yes, sir.
this is for first portion. This is middle portion. What I, I feel pain while passing this because on the tip this is for first portion, this is middle portion. What urine stops here, it doesn't come up, and it gives me pain, like just like having a needle pain. And in the stool, when I pass, it doesn't come out, and that portion is very delicate, and the stool is very hard, and it touches and it rashes there. Skin is soft, stool is very hard, it rubs there. By rubbing, it comes out.
What is the pain like?
Like just like giving a needle pain.
Can you describe that pain little bit more?
No, when they put this tube in this one, that they put jelly with the anesthesia. So for 1-2 seconds it's all right. When they push it more inside, I get rubbing in skin, tube and skin rubs, and there is a swelling. That it gives pain.
When the tube and the skin they rub, what is the feeling?
It's getting very severe pain. Just like when you put, if there is any jokham is there and you put salt, how one feels. I'm putting a lot of coconut oil before going to motion.
Why you put lot of coconut oil?
So stool comes smoothly. It doesn't give a rash on the sides of the skin. With the acidity, it's like tearing, no? Something you tear it.
Something?
You tear the cloth out, how you feel it. I feel I've done something wrong, so I keep quiet.
This feeling that you have done something wrong, can you tell a little bit more about it?
When we are in a group, your views are expressed, groups are expressed, my express. So my views doesn't tally with others. So there are people who like to get debated or something. In the gathering, I keep quiet and I like to hear it. What they say, I listen. But I don't express my views. I don't express anything. And it is since I laughed, 30-40 years I have not laughed. To with them that we should be together in the family, they should not split up.
Okay. Tell me about this feeling little more. That to be together and not split up. Tell me about this feeling.
You see, when we are together, when we are together, we are one family. When we sit separately, we are isolated. When we are together, we think of one project, one life, one family. That kind of feeling.
So tell me the feeling when you are together and the feeling when you split.
When we are together, we think of the family. When we sleep, then all feeling is gone.
Then what happens? What's the feeling about splitting?
Then I keep quiet.
Why?
Because I can't do anything.
So, what do we see basically in terms of his dynamic? He wants the family to be together always, never to split up. So, what does he want? He wants stability. He wants to maintain status quo. He doesn't want any change in this situation. So, this kind of feeling is found in the first superclass. as I said, we have 6 superclass in the, sorry, it's found in the 4th superclass. We have 6 superclasses. The first is it goes in, withdraws. In the second, there is open and shut. In the third, limiting and expanding. In the fourth, the need to be stable and settled. In the fifth, the need to get out. And in the sixth superclass, to fight and flight. Our remedies are divided according to these superclasses. So in this case, you find that his main feeling is he wants to be stable. He doesn't want any change in the status quo. And this is found in the 4th superclass. So the first thing we understand is that he needs a remedy from the 4th superclass. Wants to be stable, wants to maintain status quo. Now, how do we know which kingdom he belongs to? What is his main experience? His main experience is the sensation to split up, that something will come and affect him, and either his rectum will split up or his family will split up. So the main theme here is that something is going to happen. There is a sensation and a reaction. The sensation is the sensation of being delicate and breaking apart. This is what can happen. So when you see the main experience to be a sensation, this is plant kingdom. So we need a remedy of the 4th superclass in the plant kingdom. Now, which plant? We have to look at the sensation. What is the sensation? The sensation is to feel delicate and that it will split apart. This sensation is found specifically in the family of the gymnosperms, in the family of the conifers, and especially in the remedy Thuja. You all know very well that the keynote of Thuja is the feeling of fragility, of being delicate, of being like a glass, and that it can break apart. So if you see the rubric delusion made of glass, or delusion frail or fragile, delusion delicate, this is found in Thuja. So here in the conifer family, you have the feeling of fragile, broken, disconnected. One becomes two, one becomes split up. So this is to see that in pictures. The main feeling is fragile, brittle, glass-like, breakable, falling apart, splitting apart, broken, cracked, delicate, vulnerable. And what is the miasm? The main miasm in his case, the feeling that the way he copes up with this sensation is to avoid it. I want to avoid my rectum being split, so I put lot of coconut oil, lot of jelly, so that it doesn't split. I don't laugh, I don't smile, so that my family doesn't split. I don't fight, I don't debate, I don't confront, because my family should not split. So I will do everything to avoid this experience. To avoid is the main theme of the psychotic miasm. So we need, what are the fingers we have? 4th superclass, plant kingdom, conifer family, psychotic miasm. And then we see his main characteristic symptom, that he never smiles. And when you see this rubric in the repertory, mind never smiles, you see the remedy Thuja right there. And Thuja is in the 4th superclass, it is in the conifer family, and it is the king of the psychotic medicines, all of us know. So you see here, never smiles, cancer of the prostate gland, and delusion that body parts are delicate. This is exactly what he said. There is no interpretation here. Exactly his words. And if you repertorize, you come to the remedy Thuja. So now you have the 5 fingers here, the fourth superclass, plant kingdom, psychotic miasm, characteristic rubrics, and the keynote of Thuja, delusion, he is made of glass, delicate. So he received Thuja 1M as the remedy. Let's see what happened.
The first time you came to me, you spoke about feeling that because of my pain, other people get disturbed, right? And you feel little guilty about it and things like that. And so you say, better I keep quiet and I shouldn't talk and things like that, right? This was your feelings. How are these feelings now?
No, better.
Better in what way?
That the feeling is gone now.
Which feeling?
That to keep quiet, pain is there. No, because I don't get pain of that time.
So what is the effect of that on you?
At that time I was depressed, no? Then you gave me medicine, this one, it's cooled my brain. And then it's all subsided also.
What has subsided?
The psychology effect. No?
What was that psychology effect, if you can remember?
That all the time, at that time I was thinking on the pain only. Because there was a tube inside. And I can't think, at that time I was not, could not think anything else. That is why.
That was the feeling. And now what is, what can you do now?
No, normally I can do everything. Now it's all right. Whatever feeling was there, it's gone.
So are you better able to mix and interact with other people now than before?
But
because earlier you were keeping aloof, no? You don't want to be with others.
But I can do it, but I avoid it.
You avoid it. Why?
I don't know, it has become a nature.
Become a nature. Because you told me at that time, I have not laughed for 30-40 years like that. Right?
Now I laugh. With my grandson, then my younger brother, son is married. We have got a grandson. I play with him, and that feeling is over.
That feeling is over. You are able to laugh now.
Yes.
What difference has that made to you?
I don't know. At that time I could not laugh, no, but now I'm all right. Is there any joke or something?
The first time you came.
So, what is interesting is that he came to me at a time which was very acute. He had acute retention of urine due to prostate cancer with multiple metastases. After giving him Thuja 1M, within 2 to 3 days, his retention cleared. He could pass urine and his symptoms alleviated. And gradually, over a period of time, you can see that from 2001, his USG, 2004, USG, PSA, his PSA, which was 16.3, goes down to 0.9 and then 0.01. Remember, he was on no other medication except the Thuja. No allopathy, no chemotherapy, no surgery, nothing. And we followed him up for more than 5 years and he remained completely normal. So, this was the case. That was the only remedy given to him, Thuja 1M. And it was quite an amazing recovery that we could see. You can see the follow-ups here. So this is what I wanted to, it's a very simple thing. You see, anybody can say that feeling delicate, fragile, this is Thuja. But how can we be sure? We can be sure if all aspects of the case match. The superclass should match, means the feeling that I need to be stable, it should match. the sensation should match, the miasm should match, the psychotic miasm should match, the key repertorial rubrics must match, the keynotes must match. If these 5 aspects match, you can be sure about the remedy and you can give it with utmost confidence. So, this is what I wanted to share with you with the cases I have shown you on the recorded video and this one which I wanted to share with you. I would like to share with you also the printout of all the super classes. What are the qualities of each super class? I want to share with you some of the PowerPoints of this case. So whoever is interested, you can please write down this email ID. And if you simply send a mail, I want the handout, they will email it to you in the next few days. So in this handout, you will see all the superclass qualities, kingdom qualities. So it can give you a beginning of how to understand this system. And we will also include in this handout the entire presentation that I just showed you. Okay. So whoever is interested, you can write and these people will respond to you. So this is what I wanted to share for today. I also once again thank you for inviting me and giving me the opportunity to share my thoughts and ideas. And I share them with the intention because it has helped me tremendously in practice. I have been working for 45 years trying to come to a place in myself where I can be confident of the remedy I am giving. And I can say that now, with this idea of superclass, kingdom, miasm, characteristics, and keynotes, the 5 fingers, I have come to that point with which I can see the remedy with great deal of confidence. So I would love to share this with all of you and thank you for listening to me.
Thank you so much for this insightful session, sir. Uh, I I had read about your work before this evening, but hearing you present live is a different experience altogether. The five finger method makes so much more sense when you see the thinking behind it, not just the framework. And as someone who was genuinely curious about the person behind the work, this session answered a lot. We now open the floor for questions. Please type in the chat. We'll take them one by one. Until then, I now invite Dr. Mridul Sani sir to share his insights.
Thank you, sir, for your very nice presentations. Both video and your live presentations were so wonderful that all were mesmerized. I think I am using the word mesmerized because this way of speaking, your way of talking, and way of explaining is something miraculous, something wonderful. And on behalf of the Homeopathic Medical Association of India, and on myself also, I thank you very much for this nice presentation. May I just request our President, Dr. Shyamal Mukherjee, sir, to kindly say a few words on this occasion. Dr. Shyamal Mukherjee, if you are present, can you?
Yes, sir.
Yeah, please, sir.
Many thanks to the organizer to this seminar. Especially thanks to Dr. Sahani sir and our today's convener and our national chairman of the scientific committee, Dr. Subhash Singh, and secretary Dr. Sanjit Singh also. And on behalf of Hmai, many lot of thanks to our most respected and eminent physician of India, Dr. Rajan Sankaran sir, for his nice speech and videos present here. On many thanks to the others who is present here. Thanks, lot of thanks to Dr. Rajan Sankaran sir. Please.
Thank you,
Good
Dr.
night.
Shyamal. Thank you, Dr. Shyamal. Our organizing secretary for the next scientific seminar, which is going to be held at Jabalpur on 19th and 20th of the December has to say something for an invitation for our respected Dr. Rajan Sankaran sir. Dr. Avdesh Bhatt, can you speak out? If you are here.
Hello, sir.
Yeah.
Hello,
Ah.
I'm Dr. R.K. Gupta from Jabalpur, HMI representative MP State Board. आज का टॉपिक बहुत ही एक्सक्लूसिव रहा। डॉक्टर राजन संकरन को बहुत बहुत बधाई आज के टॉपिक के लिए मुझे, और इतना अच्छा एक्सप्लेनेशन उन्होंने प्रेजेंट किया, तो ये हम सभी डॉक्टर्स के लिए बहुत बहुत इनोवेटिव रहा। सर मैं खास करके डॉक्टर संकरन सर को मैं अपने सेमिनार के लिए जो एमपी में 19 और 20 दिसंबर को हो रहा है उसके लिए मैं स्पेशली इनवाइट कर रहा हूँ ये हमारे प्रोग्राम में, और पूरे एचएमआई टीम की तरफ से मैं उनको प्रेजेंट करने के लिए रिक्वेस्ट कर रहा हूँ कि हमारे प्रोग्राम में आए और एचएमआई के प्रोग्राम को अपने स्पीच से, अपने साइंटिफिक सेशन में एक बेहतर प्रेजेंटेशन दें। और सारे सेंट्रल टीम को बहुत बहुत बधाई जो इस प्रोग्राम में ज्वाइन किए हैं। मैं सभी को उनका आभार व्यक्त करता हूँ। थैंक यू सर।
Dr. Simi, take up some of the questions that have come up in the chat box.
Sir, there's a question: how to close the case? Only Thuja or any other integrated medicine?
No, only Thuja was given. No other remedy was given. And Thuja 1M was given, and also LM8. Okay, so this is no other medicine was given to him except Thuja.
Any other questions, Simi?
No, sir. All the questions are same. Is Thuja 1 and single dose given? How to differentiate between Thuja and Calcar?
Yes, basically you can differentiate the remedies on the basis of the 5 fingers. So calcarea carb is a mineral remedy. So the main experience of calcarea carb is that I lack something. I lack support, I lack security, I lack protection, and I want it from somebody else. So in the mineral, they always feeling something is lacking and I need it from outside. So that is a very important difference between the two. Another difference is that Thuja is in the psychotic miasm, Calcarea carb is in the soric miasm. The third difference is the characteristics. That means the Calcarea carb cravings, aversions, perspiration, modalities will be different from Thuja. So all the other fingers, so they are both found in the fourth superclass, but the kingdom, the miasm, the characteristic keynote will be different. And in this patient, the main experience was my part is delicate and it will tear apart, break apart, split apart. My family is one, it will break apart. This is very specific for Thuja. That is the main differentiation.
Next question is, sir, how to select which symptom to categories under subclass, kingdom, etc. I don't think it's a full question. Mohsin Khatib, can you explain your question? You can unmute yourself also. Any other questions?
Yeah, you can refer the patient. You can send your father to your to sir. Take an appointment for him for his cancer.
And if anybody has any other questions you think of afterwards also, you are welcome to write to the same email ID that I have shared with you, and I will answer your questions personally. Okay. So any questions you have that may arise, you can please send it to me and I will answer you.
That's great, sir. Yeah, great support for all of us. Dr. A.K. Gupta, Secretary General, are you present here, sir?
Was any surgery done in this case? No, no surgery was done. No surgery, no chemotherapy, no other medicine except Thuja. So my suggestion to you, all of you, is you do not have to change what you are doing. You see, you all know repertory, you all know keynotes, you all know materia medica. You don't have to change that. You simply add to it the knowledge of superclass kingdoms and miasms, and your predictability and confidence in your prescription will go much, much higher. That's what I'm saying. So, my thoughts are not to change what you're doing, but only to enhance it, to make it stronger.
Yes, sir. I feel that the time is running up.
Hello.
Yeah, Dr. Gupta, please, sir. You can also
Yeah,
make a
yeah.
vote of thanks.
Yeah, sure. Dr. Rajesh Sankaran sir, it was an excellent presentation. And going from super class to the last keynote, it had been a good learning all over again. Right, what we have learned from, our colleges, but the practical aspect, what you have shown, it is super. I would say super class to be a super one. And at the same time, the kind of way you have presented and started from the taking an example, I think it becomes much more evident for the person to learn when he or she himself or herself has been in there and experiencing the from starting from the experience and learning to the core of the medicine. That has been superb, excellent. And on the behalf of Homeopathic Medical Association of India, I really thank you very much, and Dr. M.K. Sahani sir, for taking up this particular webinar, monthly webinar. And today I'm very much delighted that you had a full jam-packed house, and there have been number of doctors who had been waiting outside because we could not accommodate in this. So this has been a very good experience, and I personally thank Dr. Rajan Sankaran from my side and the behalf of Hmai and everyone, all whosoever have been there in the today's webinar and learnt a lot. Thank you very much, sir.
Sir, we also make an invitation to sir so that for the Jabalpur seminar.
Yeah, and I would request, Dr. Rajan Sankaran sir, that we are going to have this 24th All India Homeopathic Scientific Seminar in Jabalpur on 19th and 20th of December. We would be very highly, obliged if you could spare your time, some time, and be there and present your presentation over there to make other people learn. It would be a very good, thing, and we look forward to your presence out there. And at the same time, we keep on learning from different webinars, but today's experience was really excellent.
Thank you, sir, for your invitation. I am not sure if I can come, but my offer will be that if you would like me to share some videos with you that you can kind of have webinars on, like what we had today, I am very open for that.
Thank you, sir. Thank you very much. We certainly would, work on that.
I also take opportunity to invite all the participants who are present here and to be the part of our national seminar that is going to be held on 19th and 20th of the December. Please join there as a delegate. You'll enjoy the place also, and also the learning systems that we are providing as a largest organizations of the homeopathic fraternity. Dr. Gupta ji, can we close the session?
Yes, I think, with the vote of thanks to each and every and all the participants, and I'm sure that everybody has, learned a lot and enriched in their experience of practice. Thank you very much, and look forward for more such events. Thank you.
Thank
this,
you,
I
sir.
request-
Thank you, everyone. Okay.
I request Dr. Simi to address the session now.
Thank you, sir. On behalf of HMAI, we extend our sincere gratitude to Dr. Rajan Sankaran for a session that was both clinically enriching and intellectually profound. The five-finger method, its clarity, depth, and practical application is something every practitioner present this evening will carry forward. We thank Professor Dr. Subhash Singh. We also extend our gratitude to Dr. Shaman Mukherjee, Dr. A.K. Gupta, Dr. Sanjeev Kumar Singh, and Dr. M.K. Sahni sir for gracing us with their presence and guidance this evening. Thank you to all the participants for joining us tonight. We look forward to welcoming you at our next monthly scientific webinar. Have a good evening.
For those who are asking the questions, they can send these questions to the email that sir has provided on the screen. You can say, and you will get the reply. He has already promised to reply all your questions, those which has not been answered. So please be on the email so that you can get the reply from him. And also, if you whatever you want to ask, you can ask later on also. And this is the email ID which has been typed on the chat box also. Kindly note it, and you can send your message there, and it will be replied. Definitely, I assure you that he will reply them. So now it is the time to say goodbye.
Yeah.
And in our traditions, we say Ami Aschi. फिर से आएंगे हम लोग. We'll come back again. We'll meet again. And this is and we all are from the same family of the homeopathy, and we'll keep meeting. And with this, the session is closed. Thank you. Thank you very much to all.
Thank you. Good night.
Again, thanks to all. Good night,
Good
everyone.
night.
Good night.